Hello world. It is Saturday, November 4th. The last video I uploaded was the day before surgery. My surgery was on October 30th, on a Monday. I got discharged from the hospital yesterday on Friday the 3rd. So my experience is not going to be typical. It's not going to be the same experience anybody else is going to have. So don't let what I'm about to say scare you if this is what you want. But again, I'm documenting this journey for myself, and I want to just document how it went, what happened. The hair loss is real, so this whole front, like, that's all I have left. So it didn't take long to start the hair loss, so hopefully it grows back. So let's start from the beginning. I was admitted 6 a.m. on Monday morning. My surgery was at 7:40. They give you a bunch of pre-op stuff, anticoagulants and stuff to reduce your stomach acid. And then I was in ICU probably for an hour or two, where they injected fentanyl for pain. And then I was back in my room. The pain was more than I thought it would be. But of course they just sliced me open, so that makes sense. They have to take your vitals every 2 hours, or maybe it's every hour for the first little bit. Everything looked like it was going okay. The worst part is that you can't drink anything until you pass the swallow test the next day and make sure that there are no leaks. I've never experienced thirst like I experienced in the hospital. They give you these sponges that you can dip into ice water and you can wet your mouth. Doesn't help. I mean, yes, it helps. Without it, I would have probably died. Not literally, but you get my point. The thirst is worse than the pain. Monday night, I was tachycardic, which means my heart rate was high. My blood count was low and it was continuing to drop. My oxygen was low, so they determined that I had a bleed and I had to go back into surgery. That was 10 o'clock Monday night. I went in for my second surgery. They found out that there was a bleed on the inside of my bowel. And yes, although I was losing blood, I wasn't losing it into the main cavity of my body. It was all draining into my intestine. So I had a blood transfusion to replenish the blood that I had lost. And then back into ICU. And then back into recovery. So then the next day, I did my swallow test. And everything came back okay. But it wasn't until probably 5 o'clock that night that I got approval from the doctor to actually drink something. Oh my God, that first mouthful of apple juice was the best thing I've ever drank in my life. I was on a clear fluids diet the first day. So soup broth, tea, juice, water. I think that's all they gave me. And then my heart rate was still high. My heart rate is abnormally high. Let me tell you. It's always, my resting heart rate is always higher than somebody normal. It's been like that for years. It seems like every new doctor that I go see and sees this, they want to try and fix it. They want to figure out why it is. And then I end up getting poked and prodded for no reason. So I think that that's what happened in the hospital. So anyhow, we moved along. I was moving along pretty good. Attention by the nurses at this hospital was mediocre, to say the least. And I don't mean that they weren't good at their jobs or they weren't nice or understanding. They were. They just had too many patients. I don't know if they had too many patients or if the patient that they had required a lot of work and a lot of attention, because it would take me forever to get anything. For the first couple of days, I couldn't get out of bed by myself, and so I would have to call somebody in if I had to go pee. Well, they put a catheter in after that, but if I had to go, whatever. And so calling somebody in, I would get to the point where I thought I was going to use the bed in the bathroom in the bed, because it took a long time. It took a long time to get ice water or ice packs or medication or anything. So I wish I experienced better care. A lot of times I felt like I was on my own. My fiance now, I guess, he was with me the first day and most of the second day because of the second surgery. On Wednesday, he went back to work and came to see me after work, because he didn't want to take too much time off of work while I was in the hospital, because he wanted to be able to be with me when I came home in case I needed help. So I felt like a lot of the time I was having to be my own advocate, and I was having to just fend for myself a lot, which it made me sad and it made me depressed. Wednesday afternoon, I got transformed into the full fluid diet, which means I got pureed soups and yogurt and pudding and custard. I'm getting kind of sick of that now, but at least it was food. The biggest issue I had was dealing with my surgeon's interns. So I only saw my surgeon a few times. I saw him the morning of the surgery. I saw him the night that I had my second surgery. And then I saw him Thursday afternoon. All the other rounds were done by his residents or his interns. And I'm sure that, I don't want to say anything bad about them. I can't imagine the stress and how difficult their job must be, but boy, oh boy, do I wish that they had gotten their shit together before they started talking to me. So Wednesday, the intern came in and said, you know what, we're going to let you rest for an extra day in the hospital, which means we're going to keep you because you've been through so much. You had the blood transfusion and we need you to rest. So I had those socks on your legs, the stockings that contract to make sure that I don't get a blood clot. And so that night the nurse took those off, took me off fluids, and I was still on oxygen and I still had a catheter. And the nurse on the night shift came in and said, have you been up and walked around today?